Ever wondered why heart health is so important? It's an intriguing question, isn't it? But the answer is even more fascinating. Heart health is not just about the heart, it's about the entire system of our body. Our heart is the engine of our body, tirelessly pumping life-sustaining blood throughout our system. It's like the conductor of a grand orchestra, keeping everything in harmony. But what happens when this conductor falls out of rhythm? This is where we begin to talk about heart attacks, a condition that is alarmingly prevalent in our society. It's a silent predator that strikes when we least expect. Heart attacks don't just happen, they are the result of a series of events, often triggered by factors within our control. Yes, you heard it right, within our control. Understanding heart health and how to prevent heart attacks is a crucial knowledge everyone needs. Stay tuned as we dive deeper into this significant topic. So what exactly is a heart attack? That's a question we often hear, and the answer is both simple and complex. In its most basic form, a heart attack, medically known as a myocardial infarction, is a sudden and severe condition caused when the blood supply to the heart muscle is blocked. This blockage is typically due to a buildup of fatty deposits or plaque in the coronary arteries, the main vessels supplying blood to the heart. Let's break it down a little further. Your heart, like any other organ in your body, requires a constant supply of oxygen-rich blood to function optimally. This blood is primarily delivered to the heart via the coronary arteries. However, over time, these arteries can become narrow and hard due to a buildup of plaque, a condition known as atherosclerosis. When a piece of this plaque breaks off, it can cause a blood clot to form. If this clot blocks a coronary artery completely, the part of the heart muscle supplied by that artery begins to die due to lack of oxygen. This event is what we commonly refer to as a heart attack. Now, what are the common symptoms of a heart attack? Well, they can vary from person to person, but there are some classic signs to watch out for. These include a crushing chest pain or discomfort, often described as a feeling of tightness or heaviness. This pain may radiate to the arms, neck, jaw, stomach, or back. Shortness of breath, lightheadedness, nausea, and sweating are also common symptoms. Some people may experience a sudden feeling of anxiety, similar to a panic attack. It's important to note that not everyone experiences these symptoms, and they can be mild or severe. For some, the first sign of a heart attack may be sudden and intense chest pain, while others may only have mild discomfort or even no symptoms at all. Recognizing these symptoms early can make a significant difference in treatment and recovery. So stay informed and remember, knowledge is the first step to heart health. Now that we know what a heart attack is, let's delve into what causes them. A heart attack typically occurs when blood flow to the heart muscle is blocked, usually by a blood clot. This blockage can damage or destroy part of the heart muscle. But what leads to this blockage in the first place? There are several common causes, and we're going to explore each one. First, let's talk about high blood pressure. This is when the force of your blood against your artery walls is consistently too high. Over time, this pressure can damage your arteries, making them more susceptible to the buildup of fatty plaques, a condition known as atherosclerosis. This buildup can eventually lead to a blockage, causing a heart attack. Next up is high cholesterol. Cholesterol is a fatty substance found in your blood. While your body needs some cholesterol to function properly, too much can lead to problems. High levels of cholesterol can cause fatty deposits to accumulate in your blood vessels, increasing your risk of heart disease and heart attacks. Third on our list is obesity. Carrying extra weight puts significant stress on your heart, increasing the risk of heart disease and heart attacks. It can also lead to other heart attack risk factors, like high blood pressure, high cholesterol, and diabetes. Speaking of diabetes, it's another major cause of heart attacks. High blood sugar levels can damage blood vessels and nerves that control the heart, increasing the likelihood of a heart attack. Lastly, let's not forget about smoking. The chemicals in tobacco smoke harm your blood cells, damage the function of your heart, and weaken the structure of your blood vessels. This makes smokers significantly more likely to suffer a heart attack. Knowing these causes can help us understand how to prevent heart attacks. By making lifestyle changes like eating a heart-healthy diet, exercising regularly, maintaining a healthy weight, managing stress, and avoiding tobacco, you can significantly reduce your risk of experiencing a heart attack. But remember, it's always important to consult with your healthcare provider before making any major changes to your lifestyle or health regimen. So, how can one prevent a heart attack? It might seem like a daunting question, but the answer is surprisingly straightforward. It all boils down to a healthy lifestyle. Firstly, let's talk about diet. Eating a heart-healthy diet is crucial. This means incorporating fruits, vegetables, whole grains, and lean proteins into your meals. It's also important to limit your intake of saturated fats, salt, and sugar. These substances can increase your risk of heart disease, so moderation is key. And don't forget about the benefits of omega-3 fatty acids found in fish like salmon and mackerel. These fatty acids can reduce inflammation and lower the risk of heart disease. Next, let's not forget the power of regular exercise. Aiming for at least 30 minutes of moderate intensity exercise a day can do wonders for your heart health. This can be as simple as a brisk walk, a bike ride, or a swim. Regular physical activity helps to control your weight and reduce your risk of heart disease. Speaking of weight, maintaining a healthy weight is another key factor in preventing heart attacks. Overweight and obesity increase the risk of heart disease, so try to keep your weight within a healthy range. If you're not sure what that range is for you, consult your doctor or a nutritionist. Now, you've probably heard this one before, but it's worth repeating. Avoid smoking. Smoking damages the lining of your arteries, leading to a buildup of fatty material which can cause a heart attack. If you're a smoker, quitting is the best thing you can do for your heart health. Lastly, regular checkups are essential. These checkups can help detect any potential issues early, increasing your chances of successful treatment. In addition to regular checkups, it's important to manage conditions like high blood pressure, high cholesterol, and diabetes, as these can increase your risk of heart disease. In conclusion, preventing a heart attack isn't about one big change, but a series of small, manageable ones. Each step you take towards a healthier lifestyle is a step towards a healthier heart. Remember, prevention is always better than cure. Can medication play a role in preventing heart attacks? This question has been on the minds of many, and the answer is yes. Medication can indeed play a significant role in warding off heart attacks. Let's take a look at some of the key medications that have been found to be effective in this regard. First up, we have blood thinners. These medications work by preventing blood clots, which can block the blood flow to your heart and cause a heart attack. Blood thinners like aspirin are often recommended for people who have had a heart attack or are at high risk of having one. Next, we have cholesterol-lowering medications. High levels of cholesterol in your blood can lead to the buildup of plaque in your arteries, which can narrow them and make a heart attack more likely. Medications such as statins can help lower your cholesterol levels, thus reducing your risk. Lastly, we have medications for high blood pressure. High blood pressure can strain your heart and damage your arteries, making a heart attack more likely. Certain medications can help control your blood pressure and thus reduce your risk. However, it's important to remember that while these medications can indeed be effective, they are not magic bullets. They should be used as part of a broader strategy to maintain heart health, which also includes regular exercise, a healthy diet, and not smoking. Furthermore, it's crucial to consult with a healthcare professional before starting any medication. They can help determine which medication is right for you, considering your overall health, your risk factors for heart disease, and any other medications you may be taking. So yes, medication can play a key role in preventing heart attacks, but it's not the only piece of the puzzle. It's one part of a larger strategy that also includes lifestyle changes and regular checkups with your healthcare provider. Medication can be helpful, but it's not a substitute for a healthy lifestyle. Let's quickly recap what we've learned about heart health and preventing heart attacks. We've explored the heart's vital role in our overall health and dived into the often misunderstood topic of heart attacks. We've identified that heart attacks are sudden and critical conditions where the blood supply to the heart is blocked, often due to lifestyle factors and underlying conditions. We've also looked at common causes, such as unhealthy diets, lack of exercise, smoking, and high stress levels. But we didn't stop there. We delved into prevention methods, underlining the importance of a balanced diet, regular exercise, and regular checkups. We also highlighted the role medication can play, especially for those with existing heart conditions. Remember, your heart health is in your hands. Knowledge is power, and understanding how to care for your heart can make all the difference. Subscribe to our channel for more interesting facts and health tips. Stay healthy.